I want you to picture something for me. Tomorrow morning you wake up, and there it is, that automatic, rock-solid morning erection you haven't felt in years. Not a weak halfway thing, the real deal. The kind you used to take completely for granted back in your 30s and 40s. If that sounds like something you've been missing, and honestly, if you're watching this, I'm guessing it does, then stay with me. Because by the time we're done here today, you're going to know exactly where 3 specific pressure points are located on your body, how to stimulate them safely at home, and how often to do it to actually see results. I'm Dr. Olivia Grant, and I've been practicing urology for over 30 years. I've worked with thousands of men in their 60s, 70s, even 80s. And one of the most common things I hear in my office is some version of this. Doc, everything still works, but it's just not the same as it used to be. And you know what? That's not in your head. That's biology. And today, we're going to talk about what you can actually do about it. No pills, no prescriptions, no side effects. Let's start with why this happens in the first place, because I think it matters. When you understand the why, the solution makes a whole lot more sense. As men get older, and we're talking primarily about guys in their 60s and beyond, 2 major things start working against morning erections. First, there's nerve conduction. The electrical signals traveling from your brain and your sensory receptors just don't fire as fast or as strong as they used to. It's kind of like having a great sound system, but the wiring in the walls is getting old. The music's still there, but something's getting lost in transmission. Second, there's circulation. Blood flow to the pelvic region naturally decreases with age. The smooth muscle tissue inside the erectile chambers, the corpora cavernosa, becomes less responsive. It doesn't relax and fill the way it once did. And here's the thing most guys don't realize. Morning erections aren't just about sex drive. They're actually your body's built-in maintenance system. Every night while you sleep, your body tries to send oxygenated blood to that tissue to keep it healthy. When those morning erections stop happening regularly, that tissue starts to gradually lose its elasticity. Use it or lose it. That's not just a saying, it's literally what happens physiologically. So what are these 3 points and why do they work? Here's the core principle. Certain areas of your body have dense concentrations of nerve endings that connect directly to the reflex pathways controlling erection. When you apply deliberate, sustained pressure to these points, you're essentially sending a wake-up call through those neural pathways. You're improving local circulation, activating the pelvic floor muscles, and reducing the neural lag that comes with age. You're not creating something artificial. You're reminding your body's own systems how to do what they already know how to do. Think of it like rebooting a computer that's been running slow. The hardware is still good. You're just clearing the signal and letting the software run the way it's supposed to. Now, before I show you where these points are, I need to address something that comes up a lot with my patients. Some of you are dealing with other health conditions. High blood pressure, prostate issues, maybe you've had a stroke or you're on blood thinners. I'm going to cover contraindications and modifications a little later in this video specifically for you, because these techniques are not one size fits all. And I want to make sure everyone is working within what's safe for their individual situation. All right, let's get into it. The first point is the perineum. Now, if some of you aren't sure exactly where that is, I want to be very specific, because this is the #1 piece of feedback I get. People say, Doc, I watched the video, but I couldn't figure out where the point actually is. So let me be as clear as I possibly can. The perineum is the soft, slightly spongy area of tissue located between your scrotum and your anus. If you're sitting down, it's the area between those 2 points, roughly in the midline. When you press gently, you'll feel it give a little. It's not bone, it's not hard. It has a mild give to it, like pressing into dense foam. Some men can feel a slight natural groove or indentation right at the midline, almost like a seam where the tissue meets. That's your landmark. Why does this point matter so much? Because the perineum sits directly over the bulb of the penis, the base of the erectile tissue that's anchored deep inside your pelvis. This is where major branches of the pudendal nerve run, and the pudendal nerve is the primary nerve responsible for erection and sensation. There's also significant arterial supply running through this region. When you stimulate this area, you're directly activating the nerve bundle that talks to your erectile tissue, and you're promoting blood flow to the deepest part of the penile root. Here's how to do it correctly. You can do this lying on your back with your knees bent or sitting on the edge of a chair, whatever's comfortable. Use 2 or 3 fingers. Place them flat against the perineum. Apply firm but not painful pressure. You want to feel it, but it should never hurt. Then make slow, deliberate circular motions. Not fast, not aggressive. Think of it like you're slowly stirring something thick. About 2 minutes is the target. Your breathing should stay relaxed throughout. If you're holding your breath or tensing up, you're working too hard. Relax your abdomen, relax your thighs, and let the pressure do the work. Now, and I know some of you are going to ask this because patients ask me all the time, what if you feel some arousal during this? That's a normal physiological response. That's actually your nervous system responding exactly the way we want it to. Don't be alarmed by that. It means the pathway is working. The second point is the base of the penis, specifically the dorsal root, what I sometimes call the hinge point. Let me show you exactly where this is on a diagram so there's no confusion. Picture the underside of the base of your penis right where it connects to your body. If you trace your fingers along the underside of the shaft toward the body, you'll reach a point where the erectile tissue transitions, where it goes from being external to being anchored internally in the pelvic floor. At this junction, you'll often feel a very slight groove or depression. That's the hinge point. That's what we're targeting. This location is significant because it's where the 2 main erectile bodies, the corpora cavernosa, converge at their deepest attachment point. The tissue here connects directly to the ischiocavernosus muscles, which are the muscles that actually pump blood into the erectile chambers during arousal. When these muscles are toned and responsive, erections are firmer and more reliable. When they're weak or underactivated, which happens with age and inactivity, everything downstream suffers. Stimulating this point does several things simultaneously. It activates the ischiocavernosus directly. It promotes venous drainage efficiency, meaning blood gets in and stays in more effectively. And it reinforces the nerve signaling at a critical anatomical junction. The technique here is slightly different from point 1. Instead of circular motion, you're going to use direct sustained pressure. Press in and hold. Not a poke, not a jab. A firm, steady compression. Hold for 5 to 7 seconds. Release, repeat. Do about 10 of these hold and release cycles. You can also add a very gentle side-to-side rocking motion during the hold phase. This helps activate slightly different nerve fiber types and can improve the overall response over time. One thing I want to be clear about for everyone, the pressure should always be comfortable. If you ever feel sharp pain, tingling that radiates down your legs, or any discomfort in the pelvic floor beyond mild pressure, stop and check with your doctor. For most men, this is completely comfortable, but your anatomy is yours, and I want you to listen to your body. The third point is perhaps the least well known, and in my clinical experience, it tends to produce the most noticeable results in men who are consistent with it. It's the sacral point, specifically the area at the base of your spine, at the very bottom of your sacrum, right above where your tailbone begins. To find it, reach around to your lower back and trace down the center of your spine. You'll feel the lower lumbar vertebrae, then the sacrum, a broader, flatter bone. Keep going down and you'll reach the very bottom tip of the sacrum before the tailbone begins. That area, and specifically the soft tissue just to either side of that tip, is where you want to work. Here's why this is such a powerful point. Your sacral nerve roots, specifically S2, S3, and S4, are the primary parasympathetic outflow for erection. These are literally the nerves that carry the get hard signal from your brain to your erectile tissue. The sacral plexus is the command center for pelvic function. When circulation in this region is sluggish, when the muscles around the sacrum are tight from sitting all day, when nerve conduction here is compromised, it creates a bottleneck. Everything downstream gets a weaker signal. By stimulating the sacral point regularly, you're improving local circulation to the nerve roots, reducing muscular tension that can compress those pathways, and reinforcing the neural signal at the source. Some of my patients have told me that working this point consistently was the single biggest change they made, more noticeable than the other two combined. I think it's because most men have never paid any attention to this area their entire lives, so the response when you start stimulating it can be quite pronounced. The technique for this point, you can use your knuckles or a small firm ball. A tennis ball works well. placed on a firm surface. Lie back on it so your sacral area rests on the ball and just allow your body weight to create the pressure. Or if you prefer, you can use your thumbs to apply bilateral pressure on either side of the sacral tip. Hold for 30 to 60 seconds, then shift slightly and repeat. A total of 2 to 3 minutes here is sufficient if you're using the tennis ball method. And honestly, a lot of my older patients prefer this because it requires zero effort from your hands. Just lie on a yoga mat, position the ball under your sacral area, and breathe. The pressure is gentle and sustained. Some men fall asleep doing this, which is actually fine because your body relaxes completely and the nerve response can be quite significant. Now, I want to address something directly because I've heard this concern from patients and I've seen it come up in online discussions too. Some of you are wondering, does this actually work, or is this just feel-good advice with no real mechanism behind it? I get it. There's a lot of noise out there. A lot of guys have been told by well-meaning people and not so well-meaning marketers that this supplement or that device or this breathing technique is going to change everything. And most of it is garbage. So let me be straight with you. These 3 points work through established neuroanatomical and vascular pathways. The perineal stimulation activating the pudendal nerve is not controversial. It's taught in pelvic floor rehabilitation programs. Sacral nerve stimulation improving erectile function has been studied in clinical urology for decades. It's literally the basis for sacral neuromodulation procedures used for severe pelvic dysfunction. The ischiocavernosus activation at the penile base is consistent with what we know about pelvic floor physical therapy outcomes in men with erectile dysfunction. What we're doing here is a simplified, accessible, at-home version of techniques that exist in clinical practice. No, it doesn't have the same intensity as a clinical procedure. But done consistently, and I mean daily, not twice a week when you remember, these techniques can meaningfully improve nerve responsiveness and pelvic circulation over 6 to 12 weeks. That's a realistic time frame. Anyone promising you dramatic results in 3 days is selling you something. Now let's talk about special situations because this matters for a lot of you. If you've had a stroke, you can still use these techniques but work with lower pressure and shorter duration, especially in the first weeks. Your nervous system may be more sensitive or have altered response patterns. Start with 1 minute per point instead of 2 once daily and build gradually. If you're on blood thinners, avoid the perineal point entirely for the first month. The tissue there has significant vascularity and we don't want to cause any bruising. Focus on the sacral point, which carries minimal risk. If you're on medications for an enlarged prostate, finasteride, tamsulosin, dutasteride, these techniques are generally compatible. However, be aware that some of these medications already affect smooth muscle tone in the pelvic region. Your baseline response might be different from someone not on these medications, and that's okay. Don't compare your results to someone else's. If you have active prostatitis or any current pelvic infection, do not do perineal massage. Full stop. See your doctor first. And for those of you who are not circumcised and wondering if that changes anything about these techniques, it doesn't. These 3 points are all external to the penis itself and are not affected by circumcision status. The anatomy of the perineum, the penile base, and the sacrum is the same regardless. What about the role of the prostate specifically? I get this question a lot. The prostate does contribute to erectile function, though its primary role is in ejaculation rather than erection itself. However, the prostate sits right in the middle of the pelvic neural and vascular network we're talking about. Poor prostate health, chronic inflammation, benign enlargement can indirectly impair erectile function by causing local inflammation that affects nearby nerve and vascular tissue. The techniques in this video aren't specifically targeting the prostate, but improved pelvic circulation and reduced muscular tension in this region can create a better environment for prostate health as a secondary benefit. Let me give you a practical daily routine you can actually follow. The whole thing takes about 8 minutes. Morning is best, ideally right after waking, before you get out of bed. Start with point 1, the perineum. 2 minutes of slow circular pressure. Keep breathing steady. Then move to point 2, the penile base. 10 hold and release cycles, 5 to 7 seconds each, total about 90 seconds. Then finish with point 3, the sacrum. And here's where the tennis ball comes in handy because you can just lie on it while you're still in bed with a firm pillow underneath. 2 to 3 minutes, total time, roughly 8 minutes. Do this every single morning. Not most mornings, every morning. The nervous system responds to consistency. If you do this 3 days on, 2 days off, you're essentially restarting the process every week. Commit to 60 days before you evaluate results. I tell my patients, give it 60 days of daily practice, then tell me what you're experiencing. That's a fair test. In the first 1 to 2 weeks, some men notice improved sensation in the pelvic region. In weeks 3 through 6, many start noticing that morning erections are more frequent or slightly firmer. By weeks 8 through 12, most men who have been consistent report meaningful improvement. Not everyone experiences the same timeline. Age, cardiovascular health, medication, sleep quality all play a role. But the direction of change, for men who are consistent, is almost always positive. One last thing I want to say, and I say this as someone who has spent over 30 years in urology, erectile health is not separate from your overall health. These techniques will work better if you're also sleeping enough, if you're not smoking, if your blood pressure is reasonably controlled, and if you're moving your body regularly. I'm not telling you to run a marathon. A 30-minute walk most days does more for your vascular health than almost any supplement on the market. But here's what I want you to take away today. You are not stuck. The changes that happen with age are real, but they are not irreversible for most men. Your body has not forgotten how to do this. The pathways are still there. The tissue is still capable. What it needs is consistent, targeted stimulation to remind it, to retrain the response that time and inactivity have dulled. Press these 3 points. Press them daily. Give your body the signal it's been waiting for. And the morning you wake up feeling like yourself again, that solid, automatic, no-effort response, you're going to know exactly why it came back. If you found this helpful, drop a comment below. I personally read through them, and I'll be doing a follow-up video answering your questions directly, especially for those of you dealing with specific medical situations. And if you know a guy who needs to hear this, share it with him. Most men won't bring this up with their doctor. So sometimes a video like this is the closest they get to real information. Let's change that.